video number 9, How to Stop Binge Eating. Binge eating disorder, BED, is commonly known by compulsive overeating or consuming abnormal amounts of food while feeling unable to stop and a loss of control. Binge eating episodes are typically classified as occurring on an average of minimum of twice per week for a duration of 6 months. Though BED can occur in men and women of normal weight, it often leads to the development of unwanted weight gain or obesity, which can indirectly reinforce further compulsive eating. Men and women suffer from BED struggle with emotions of disgust and guilt and often have a related comorbidity, such as depression or anxiety. How to identify whether you are prone to it or not. Anyone can be affected by binge eating. Many people will occasionally binge on food. This doesn't necessarily mean you have a binge eating disorder. Here are some symptoms of binge eating disorder. You can eat much faster than normal during a binge. You eat until you feel uncomfortably full. You eat a large amount of food when you're not hungry. You eat alone or secretly due to being embarrassed about the amount of food you are consuming. You have feelings of guilt, shame, or disgust after binge eating. People who regularly eat this way are likely to have a binge eating disorder. Causes of binge eating disorder. Genetics. People with BED may have increased sensitivity to dopamine, which is responsible for feelings of reward and pleasure. There is also strong evidence that the disorder is inherited. Changes in the brain. There are indications that people with BED may have changes in the brain structure that result in heightened responses to food and less self-control. Body size. Almost 50% of people with BED are obese, and 25 to 50% of patients seeking weight loss surgery meet the criteria for BED. Weight problems may be both a cause and consequence of this disorder. Body image. People with BED have a very negative body image. Body dissatisfaction, dieting, and overeating contribute to the development of the disorder. Emotional trauma. Stressful life events such as abuse, death, separation from a family member, or car accident have been found to be risk factors. Childhood bullying due to weight may also contribute. Other psychological conditions. Almost 80% of people with BED have at least one other psychological disorder, such as phobias, depression, post-traumatic stress disorder, PTSD, bipolar disorder, anxiety, or substance abuse. Risk of binge eating. Binge eating can be associated with serious psychological problems including depression and anxiety disorders. These feelings can be made worse over time while the person is still binge eating. A common physical effect of binge eating is weight gain, which can lead to obesity. This can put you at risk of a number of related physical health problems, some of which can be life-threatening. These include high cholesterol, high blood pressure, which can increase your risk of cardiovascular diseases such as coronary heart disease and stroke. Diabetes, a long-term condition that causes your blood sugar levels to become too high. Osteoarthritis, a condition that causes pain and swelling in the joints. Some types of cancer, such as breast cancer and bowel cancer. How to stop binging. Keep a food and mood diary. Identifying your personal triggers is an important step in learning how to control your binge impulses. Practice mindfulness. This can help increase awareness of your binge triggers, all while helping you increase self-control and maintain self-acceptance. Find someone to talk to. It's important to have support, whether it is through your partner, family, or friend, binge eating support groups, or online. Choose healthy foods. A diet consisting of foods high in protein and healthy fats, regular meals, and whole foods with lots of fruits and vegetables will help keep you full and provide the nutrients you need. Start exercising. Exercise can help enhance weight loss, improve body image, and improve your mood and anxiety symptoms. Get enough sleep. Lack of sleep is associated with higher calorie intake and irregular eating patterns. Ensure you're getting at least 7 to 8 hours of good sleep per night. BED is a common, under-recognized eating disorder that can seriously affect your health. It's characterized by repeated, uncontrolled episodes of eating large amounts of food and accompanied by feelings of shame and guilt. It can have very negative effects on your overall health, body weight, self-esteem, and mental health. Luckily, very effective treatments are available for binge eating disorder, including CBT and IPT. There are also many healthy lifestyle strategies that you can implement in your everyday life. With proper care and support, you can stop binging and live a happy, healthy life, and you can start today. Thank you for watching. See you in the next video lesson.